So here's the taping for DeQuervains. We know that the pain typically for DeQuervains is really right here, but it can also be radiating. So we want to tape from just distal to the IP joint of the thumb, and we're going to go all the way to the first dorsal compartment, and then if his pain is radiating, whatever direction is how you want to end the tape. So you can even make it up here or go slightly over here. Today we're doing a Y cut so that it does grab more area. Now, this is a pediatric patient, so you can see a 2-inch is actually, pretty big for his little thumb. So what I like to do for this taping, especially if they have a smaller hand, is after you've cut the strip about, 2/3 the length or so, and if you want to do the Y cut, go ahead and make a Y cut. But to make this part on the thumb a little more narrow, is you just take the piece of tape and you fold it, and then you take your scissors, always making sure you have sharp scissors. And I'm just going to kind of cut into the tape to make it about half the width, just like that. So you can get rid of your pieces you're not going to use. And then now it's going to be less cumbersome to get that tape all the way around his thumb and go up. So from here, we want to take an anchor, and remember we don't want to touch the adhesive, so I'm just going to peel that part off, and then I'm going to place it on clean, dry skin on his thumb. Then after you've secured it that way, then I'm going to flip over a piece here so that you can grab the backing without touching it. Now, before I start putting it on, I want to make sure and get a stretch out of his joint. So I'm going to have him bend as far as he can go in the MCP joint, go over the MCP joint with no stretch on the tape at all. When you get to the wrist, I need him to really try to ulnarly deviate. Again, no stretch at all on the tape. Now when I get to this Y cut here, that's where it's really important to make sure and peel off the tape on both sides, but not to pull off the whole thing. So I'm going to have him just relax as I go up, no stretch on the tape, grab my other piece, and I'm going to kind of spread it out, no stretch on the tape there. And then you can take the backing of your piece of tape, make sure there's no wrinkles. So we want to get out any kind of wrinkle that there is. You may have to kind of adjust it a little bit, but we want to take it and really rub it down here, create some heat so it really sticks on well. And then you can kind of check to make sure you did it well as long as it's wrinkling. We want to see this kind of a wrinkling up. To secure the thumb piece on there, so we don't want it to migrate off, you're going to take another side strip like this and cut it so it's long enough to go around the thumb. Take an anchor piece off here, then place that on the thumb with no stretch at all. I'm going to go around his entire thumb, making sure not to cause any kind of compression. Now we know that this is where the area of pain is, so after we put the stabilization strip on, now we want to decompress it right over that first dorsal compartment. So I've taken a strip and I've just made sure that it doesn't overlap itself. So actually by the time it gets on there, it probably will get a little longer. So for his wrist, I'm going to actually cut it just a little shorter. And then I'm going to take the tape. You want to rip the back here, place your two thumbs on there, grab the back of it, and I'm going to have him deviate his hand as I put it on about 50% stretch, just from my here to here, the stretch is there. No stretch, no stretch. And then I'm going to just place it over there and place it on this side of his wrist, heat up the adhesive, and then ask him to move and make sure that everything is moving, is looking good. Okay? And that is the taping. This is a rock taping technique for DeQuervains.